Now we're looking at the criteria for selecting an essential drug. Now, we define essential drugs earlier as what? A drug that must be available always in the right dosages and easily accessible to a particular population. That's like a drug that is used in solving most health conditions that are common to a particular population. So, what are the criteria? If I want to say a drug is an essential drug, what are the things that I must have looked at for me to now say the drug is actually an essential drug? So, that's what we got. So, you should know that selecting an essential drug is guided by what World Health Organization and the various ministries of health in the different countries we have, and is adapted by countries to meet their national health. Do you understand? So World Health Organization can't actually decide for everybody, but at least they establish the benchmark that everybody will start working from. Okay. So the main criteria include what? The drug must be relevant to that particular community. So it must be able to address diseases and health conditions that are very common in that particular population. Okay. Evidence of efficacy and safety. So people must have used that drug. It must have worked for them. That's you could say that the pharmaceutical, this thing, what do they call it? The processes of approving the drug. When they do all those testings, it must have worked. Do you understand? There must be evidence that the drug actually works, because if you come to a particular population and you dispense a particular drug for them and it happens to cause harm to them, you might lose trust forever. Do you understand? So it's a very, very sensitive area. So quality assurance. So drugs must meet the international standard for quality, stability, and bioavailability. Comparative cost effect. So in a particular class of drugs, you must always choose the one that has the best therapeutic outcomes at the lowest price. Do you understand? You have different types of drugs under the same class. That's why we go to pharmacology and all of that. So let me say for antibiotics now, you can have what? Ciprofloxacin. A lot of them. Do you understand? So you just want to choose the one that has the best effect at the lowest price. So availability and accessibility. Drugs should be consistently available in appropriate dosages. Must also be suitable for use in different levels of health systems. So suitable for the local conditions. So, must be appropriate for the country's infrastructure, climate, and understand. So some depend on, you are looking at the country, is it a desert, is it a waterlogged area, and all of that. So choose those drugs that have the properties that will suit that country. So rational use potential. Drugs should be easy to prescribe, dispense, and use correctly by patients. So equity considerations. Selection should ensure fair access, especially for vulnerable groups like the poor people. Do you understand? So in sharing the drugs or making the drug available, you should not consider status like, somebody is rich, somebody is poor, all this kind of thing. You should just make it this is a health issue. So in health issue, you make it equal amongst all the people.